thoughts on imaging, clinical practice. The the thing to remember, and this is a big problem I see in clinical practice in my own profession, chiropractic, but I'm sure it exists in other professions, but I don't know to what degree because I don't operate in those worlds. But I know myself, and I work with a medical doctor, and we work together to with patients, and we both operate on this like this simple ethos of like don't use fear as a way to communicate with patients about what's going on with them when we're reviewing histories, exams, and imaging, and just to set the situations more, set them up more like we're explaining, it's an explanatory conversation, and we're utilizing the information we have to guide you towards what we think could be a good solution. And you're not necessarily, what you do with that information and decision is up to you. And this is the big issue I see, especially around like imaging. I've been going over a lot of MRI things, X-ray things, and we'll dive deeper into those things over time. But the big issue I've seen, because I've worked in clinics like this, I've been to workshops over the years with leaders in the professions that help that guide you towards using fear as a basis for compelling people to make a decision about their care. And a lot of times you use a time pressure, fear, and then try to compel someone to close a deal on a long treatment plan. And then we will dive into some more of that next time. But it's very easy as a clinician to turn around, get an MRI report, X-ray report, and even the images from those reports, and to turn around and create a sense of fear and urgency in the person in front of you. And what we hello, and what we run across is then the patient is set up in a situation where they might get involved in some care plan that they didn't necessarily need, and we have to always be careful of that. It's like, I understand that people run businesses, but if you're operating your business on this idea that I can get these x-rays of a person on day one when they come in with a little bit of neck pain, and I can use everything I see on that x-ray to compel that person that if they don't do as I say, everything about this x-ray is going to get worse, or and the only solution for them is to engage with me for long term, and to pay me a lot of money to get there. And you just unfortunately my profession runs rampant with these kinds of practices. And I've worked in clinics where that was the norm, and that was pushed on us when we were onboarding and going through rehearsals with our higher ups, when we were onboarding, and when we were talking about how to communicate with the patient when you take all these x-rays on the first day. And there's always that push towards using fear, appealing to their emotions, and creating this time pressure and sense of urgency to get the person to turn around and hand you their credit card and sign up for as much care as possible. Whatever, putting person in debt a lot of times to to get them started with your care package that probably isn't necessary at all. Most of the things that you're showing them on the image are not new, and a lot of them, these people were existing perfectly fine before some incident maybe irritated them. And the idea that they're only going to get worse if they don't sign up today. And I've even seen people go as far as saying, they would say, well, I need, this is a lot of money you're asking me to spend. I need to discuss this with my, husband or wife or whatever. And, I've even seen people, when presented with that argument from the patient, say to them, well, how much does your significant other truly care about you if they are not going to say yes to this care plan? And like really digging in on that fear and emotional aspects just to get the sale, and unfortunately, when you're dealing with things as complex in nature as musculoskeletal pain, especially if it's chronic, there's a lot of layers many times to peel back with a person. It can be very, very easy to push those buttons until the person caves, signs up, spends a bunch of money that probably wasn't necessary at all. And it's just, I just want people to understand that if they're having, like some a little bit of acute or chronic back pain, they are going to seek some sort of professional advice. And if whoever you go to see insists on some kind of X-ray or MRI before they're going to do care, yeah, why those things are technically necessary is to rule out any big red flags that might mean you need a referral out, like there's some sort of fracture that's gone undiagnosed, or some kind of disc herniation that's so big that it's creating big problems. So any other reason they're being used is probably as a sales tactic. So not proud to say that, but it's true. And it's just some information for you as a consumer. If you're going out there, just be careful when somebody starts insisting on some imaging that might not be necessary, and they're going to turn around and here comes the speech. And unfortunately, the goal is to create fear and urgency with some time pressure and try to force you to make a decision that might not be in your best interest. So with that said, check out my YouTube channel for other things, tons of videos there, and talk to you later.